Hi, this is Dr. Johnny Liu from Doctor's Choice, and we are going to go over more Medicare cases. So we have another Medicare case here, difficult case, somebody who's under 65, who's disabled on Medicare Advantage and cannot afford the prescription copays. So the example here, somebody says, I am on Social Security disability insurance. I have no choice for health insurance other than Medicare. It's really expensive. I do not use, I'm on a Medicare Advantage plan because that's all I could afford. And the problem I'm running into is that it's apparently illegal to use copay assistance programs from pharmaceutical companies, and I can't afford medication and there's no help. I don't qualify for Medicaid, so I don't qualify for any of the assistance programs because I make just enough not to qualify, and the pharma companies have laughed at me. I think that might be an exaggeration, but I get the feeling when I've tried to get help for my prescriptions. So they say, you have Medicare, too bad. I know that the prescription costs are capped around $2,000 at this point, but it would mean that I have to spend $2,000 that I don't have. So that's not really helping. I'm in a space where I make just enough not to qualify for most of these things. What do people do? It seems really unfair that this is happening and the copay assistance programs do not work. So unfortunately, that's a difficult situation to be in. There are a lot of folks out there with disability where they're making just enough over the threshold that they're not qualifying for Medicaid, and they have to go on just Medicare only without the dual eligibility. So in situations like this, couple things to really consider. One is absolutely the pharmaceutical coupons are not going to work. And there's a big difference between pharmaceutical assistance coupons and pharmaceutical assistance grants. And that's really the key point here. So a lot of times what happens is that coupons will not work with any federal programs. And the pharmaceutical companies, they give away these coupons to anybody because they know that they'll be getting essentially the other half or more of the cost of the prescriptions from the plan itself, especially if it's an employer plan and so forth. Versus Medicare limits pharmaceutical assistance programs to only grants. So you can apply for these grants. They are more time consuming. You have to oftentimes send in your tax returns. You have to verify your income. And oftentimes these grants, they have a lot more leeway in terms of income allowance versus Medicaid. So that's one thing to really look for. A website that we use is called needymeds.org, which you can look at all the different grants that are available and you can apply. And it's interesting, we've had clients that make $80,000, $100,000 a year that qualify for these grants. So it really does not hurt to really look at these programs. And then the other option to consider is contacting Social Security, because just because somebody doesn't qualify for Medicaid, which is state assistance, they may still qualify for extra help, which means that they can get some relief on the copays, and also the state pharmaceutical assistance programs that are outside of Medicaid. Those may come in and help in certain cases with prescription costs. And then the last option is to talk to your provider, because sometimes the doctor, or I would say almost all the time, the doctors really don't know what financial situation you're in. A lot of times these doctors, I remember, we got 5 minutes with a patient. So you're really addressing the medical concern, you're renewing medication refills, you're sending them out the door, and then you got 40 other people waiting. So to come in and say, hey, look, I'm not going to be able to fill these medications because I can't afford them. Maybe the doctor can say, look, maybe there's another option that's available, a lower cost generic that's going to be maybe a tier 1 or tier 2, maybe a $0 copay on your plan. So we've seen that happen more often than not, and it's not because the doctor you need those medications and that's it. It's because the doctor doesn't know that you can't afford these medications. So that's oftentimes a last resort to consider. Maybe it's a first resort, because that means that you don't have to go and apply to all these programs. So there are programs available. Make sure you're getting a pharmaceutical assistance grant with Medicare. Again, look at extra help, look at the state pharmaceutical assistance programs, and then also talk to your doctor.